Let's bring in Ohio Republican Congressman Brad Wenstrup. He's a member of the House Ways and Means Committee. He is also a licensed physician. So, Congressman, is the administration going too far or not far enough with this?
Well, you know, what we can't afford to do is nothing. And so we pass our bill in the House and it's over at the Senate. And I would like to see them pass that, knowing full well that there's more that we have to do. The administration understands that, and certainly we understand that. And if we as members of the House of Representatives have to be called back into session, then we should do that, because time is of the essence, and assurance is what the American people need that we are going to do something. We want to make it clear that this is something that we're going to try to do through a transition, through a health care situation that will have an end to it, and we want to transition people. We are looking out for the small businesses and for the individuals. We want employers to not lose their employees. We want the employees to either pay their bills or be able to pay their bills or delay their bills. So those are the types of things that we're working on, and we'll continue to do so. Make sure that we don't have some people falling through the cracks. You know, this is a unique situation. We have to act in unique ways, and I think a lot of good ideas are coming forward, and we're just trying to get it done, and some of it very quickly. Mnuchin was talking today, too, about this infusion of cash, and that's because he feels an urgency, and I think we all do, to make sure we get some cash into people's hands so that everything doesn't fall apart. We want to have a smooth transition through the healthcare crisis and through the economic situation.
By the way, you mentioned something as we were saying hello to each other during the break, that perhaps food stamps, or at least the card, the equivalent card for that, could be used for these takeouts at restaurants, might be able to help some of the restaurants. And those people who usually go to grocery stores might not be able to get what they want at the grocery stores. That might be, you'd have to make a special allowance for that, though, correct?
Correct, and this would take some of the pressure off of the grocery stores, and at the same time help the supply chain to going into the restaurants, which many in Ohio, our restaurants are closed except for carryout. So this would help there, and also help with the employees of the restaurants. So we have to be innovative, and I think that we're going to continue to have good ideas.
Well, let me talk about the health issue here, because you have I guess she was a director of health in Ohio, Ann Acton, who said last week that there could be as many as 100,000 people infected by the virus in Ohio alone. Frankly, that figure seems a little exaggerated in my eyes. I don't know about what you think about that figure first, but you are a physician, and I'm wondering if our medical system is prepared to deal with a worst-case scenario.
You know, when it comes to numbers, first of all, I'm kind of like Dr. Berg said, I don't like to use these projected numbers because there's all kinds of models out there, but let's get prepared. You know, in Cincinnati, we're very lucky. We have a health collaborative amongst all of our hospitals. As much as they might compete, they do come together on issues like this, and being prepared, who has what, how we can work together. That's important in every community, and we're fortunate in Cincinnati to have that level of collaboration. But at the same time, you know, a lot of things are happening. It's a matter of getting the tests, etc. I think we've done a really good job of making the point known that what we are trying to do is prevent as much as possible to stay below the line of where our healthcare system would be overrun. And so it's not just prevention, but it's also putting some elective cases on hold so that we are ready. There's some bumps in the road, and there's things that we can do better in the future because of lessons learned through all this.
There's no better health system anywhere in the world. Congressman, great to see you. Thank you very much for being here. Appreciate it.